Thank you, Chairman. Thank you, Councilman Collins, for joining us here today, and congratulations on your nomination. And as you and I talked in my office, of course, this is very personal to me, also being a Marine, Iraq veteran, someone who has used VA healthcare services and as also receives a disability rating from them, making sure the VA continues to be, foremost taking care of our veterans is important to me, especially in Arizona. So I have a couple of questions, more Arizona focus. So the Be Connected program, operated by the Arizona Coalition for Military Families, had began as an Arizona veteran suicide prevention program and has grown to serve the state's veteran population and their families by connecting them with mental health resources and more, which sometimes cannot be met within the hospital system. It receives 1/3 of its funding from the state of Arizona and 2/3 from the VA, and renews its contract with the Phoenix VA annually. The Phoenix VA recently said that it no longer intends to enter into another contract with the Be Connected program and will stop funding on March 31st due to budget constraints. So if confirmed, will you commit to work with me and the other members of the Arizona delegation to ensure the VA finds alternative sources of funding so Arizona veterans can continue to receive this critical services through the Be Connected program?
Yes, Senator. I mean, one of the things is it's good to see you, and it's good to see you over here in your seat as we serve together. Look, also touring the same ground in Iraq, we know that issue coming back and that transition that's been mentioned many times here before. It concerns me. And I'm going to say what you're bringing up right now, it concerns me that as a VA that there would be concerns about funding a program that actually goes to what is one of my major concerns, and that is the issue of death by suicide and looking at or taking it even to a homelessness issue as well. Mm-hmm. So those are the kind of programs I think are priorities. So from my perspective as a secretary, it's going to be about priorities. And priorities are what we're seeing today is 17 people not with us anymore. It's not satisfactory. Over 40,000, I believe, those are more homeless. It's not satisfactory. A 5,000 waiting list in Alaska is not satisfactory. So budget items will match up to the priorities of what I want to have, and that's what I look forward to working with you on and look forward to getting more information on that issue.
Thank you. Now I'm focusing and moving on to kind of the HUD-VASH program. Something that's very important in terms of reducing homeless veterans. But we did see a growth in homeless veterans increase by 7.4% from 2022 to 2023, which is for a variety of reasons, not just the HUD-VASH VA program. The program, as pairs rental assistance through housing vouchers targeted at veterans specifically, with case management and other supportive services. If confirmed, what would you do to support HUD-VASH program and increase collaboration between the VA and HUD?
That is something that I think, as you and I talked about in the office, is very important because we look at the areas for disability, we look at the DASH, we look at this, is it actually enough to provide people the resources to have a home? For me, I will look at this issue of homelessness not just as a VA issue. I'm going to look across the spectrum with HUD and with any other department in which we can to make sure that this is something that is not the dark spot on a veteran service where we have homelessness like that is spoken of all the time. Mm-hmm. So I'm willing to take whatever we can in the VA, outside the VA, and I'm looking forward to having a good relationship if confirmed here, and if confirmed, Mr. Turner confirmed at HUD, that we're going to have a lot of conversations about this.
Right, and you and I talked about this in my office too. The studies have shown that the whole health coaching can help veterans make meaningful progress towards health goals, reduce stress, and improve quality of life, and overall, bring down the long-term costs for the VA, because then you have healthier veterans at a younger age, means you have healthier veterans at an older age. The VA currently employs around 200 full-time health coaches, but there are about approximately 20,000 to 30,000 health and wellness coach encounters where they have 20 to 30,000 health and wellness encounters per month. This number is expected to increase as veterans demand more coaching when it comes to life and health. As we discussed in our meeting, the VA has serious health coach vacancies. If confirmed, what would you do to safely help remove current barriers to healthcare professionals interested in becoming health coaches with the VA?
Senator, as we discussed, that's one of the issues I see, and I think you and I both saw from the House, and now you over here in the Senate and myself, is why are regulations keeping us from getting to the help that we need? And I think that's what I want to take a look at after you and I conversation. We get confirmed. We're going to look at this and say, why is getting from A to D? Why is B and C an issue? Is a proper, or could we remove C and just go A, B, D? I think those are the kind of things, because what you just talked about again is how do we keep people? At the bottom line for me, this chaplain's heart, this secretary's heart is always going to be about helping the veteran get the help that they need in all areas of their life. And if we don't do that, then we're making a mistake. We're missing the mark. And you and I have seen that, unfortunately, up firsthand. As someone who's actually counseled with those who thought about taking their life, those who are serious issues, we've got to have every help we can have.
Okay, thank you. I yield back.
Thank you and welcome.